ultra-processed foods had about 28% higher risk of total death. How you live can influence not just disease prevention.
I started a plant-based diet accidentally. My husband, he lost 70 pounds, stopping diabetes medications like insulin 60 units in literally 3 days. People really are surprised how quickly they can feel better. But the majority of individuals are really frustrated with traditional healthcare.
Have you ever wondered why chronic diseases seem to be rising, even when modern medicine is more advanced than ever? What if the answer starts on your plate? In 2022, a multinational cohort study showed that people consuming two or more daily servings of ultra processed foods had about 28% higher risk of total death compared to those eating minimal processed foods. On the flip side, a 2023 meta analysis found that sticking to healthy plant based diets can dramatically lower the risk of type 2 diabetes, heart diseases, cancer, and even early death. A randomized clinical trial published in 2024 demonstrated that a whole food plant based lifestyle program significantly improved blood sugar control, reduced inflammation, and even allowed many participants to stop or reduce their diabetes medications. Welcome to Khan Clinics. I'm your host, Dr. Amir Khan, and today we are going to explore how you eat, how you live can influence not just disease prevention, but disease reversal. Guiding us through this journey is one of America's leading lifestyle medicine physicians, Dr. Lori Marbas. Dr. Marbas is one of the most compelling voices in modern lifestyle medicine. She's double board certified physician, has been using food as a medicine long before it became a global movement. Since 2012, she has been transforming patients' lives through evidence based nutrition and habit changes. She runs a concierge practice at drmarbas.com. She co founded the Healing Kitchen. She hosts the widely respected Dr. Lori Marbas podcast, where she interviews leading experts on chronic diseases reversal and the future of health. She's a physician, innovator, educator, and pioneer. Dr. Lori Marbas, welcome to the show.
Thank you for having me.
Dr. Marbas, let's start by talking about why did you decide to build a telehealth medicine, a plant-based telehealth platform? Explain to our
Sure.
audience, please.
Okay. So first of all, I started a plant-based diet accidentally when a patient of mine had a significant improvement in her daughter's attention deficit disorder. So it's a long, fun story, but it really got me digging into the research back in 2012. And at that point in time, I transitioned my own family over. Back then, my kids were young, 13, 15, and 18. So they're all late 20s, early 30s now. And during that time, I also was able to transition my husband. He lost 70 pounds in a matter of 3 or 4 months. And I've seen things happen with patients like stopping diabetes medications like insulin 60 units in literally 3 days just by changing what was on the end of their fork. And there's story after story like that. So I had the opportunity to work in a acute setting of telemedicine. And a friend of mine was like, Lori, we really should consider starting our own telemedicine program. And so we did. And we launched plant-based telehealth. It took us a year to set up everything and get it going. And we happened to launch March of 2020, right when COVID was hitting the United States. And it's like all of the obstacles around telemedicine just kind of collapsed. And so I consider that divine intervention, and that's why we started it, and we went from there to bring it to everyone that we could.
Yeah, excellent. What of the challenges did you see while introducing this telemedicine and it's plant-based compared to what were you practicing before?
So before I was, I'm a family medicine physician. So in person, you run across the same situations. It's prescription after prescription. People continue to get worse. We really have to learn the language of, behavior change and helping them understand habits. But when you bring in something that's very powerful, like a whole food plant-based diet, people really are surprised how quickly they can feel better. So that's one thing. But I think the challenges are unique. One is just the technology. I think it's much easier now. People are used to being telemedicine. The last 5 years, there's been a tremendous education that's occurred to the general population on how to use Zoom and how do you log on to a doctor's appointment. So in those beginning days, those were probably the worst, but patients were pre-selected, right? They self-selected themselves. So I didn't have to do so much, conversation. I had known there was a need. There was a market need for plant-based doctors to be available to people who really felt like the regular physicians just didn't know how to understand the needs of a plant-based person, or that their medications would need to drop. We are not taught in medical school how to de-prescribe. That was definitely, I think, a challenge for a lot of patients. And we already had a significant public following already.
Dr. Marbas, you practice across 50 states in the US. We're eager to know what sort of trends have you seen in diet in the states, and how were you able to practice or influence their habits in molding them to go on a plant-based diet?
As far as trends, I think what I would say I'm seeing, again, these are self-selecting patients or patients that were drugged along by a significant other who was already consuming a whole food plant-based diet. And, maybe it was a spouse or a parent or a sibling or something. But the majority of individuals are really frustrated with traditional healthcare because, again, there's just more prescriptions. They don't feel better. They're not getting any benefit from what they have been doing. And physicians, unfortunately, in today's society are really time restricted. There's a lot of, admin burdens. And so that removes them from able to really sit down and create really good relationships with their patients. Luckily, the way I practice, because I work for myself and I am licensed everywhere, I can take the time to see patients. So if I need to spend, half an hour, or hour and a half, whatever, I can do that.
Excellent. Thank you for explaining that. What a remarkable journey we've just experienced together. The path to health isn't always straight, but it's always worth the effort. I hope today's conversation inspired you to take the next step in your wellness journey, armed with new knowledge and a fresh perspective. If today's episode left you inspired, share it with someone who need to hear this. Give us a thumbs up and your opinion. Keep exploring, keep evolving, and we'll see you in the next episode of Khan Clinics.